Welcome to the Other Side of DC podcast, where we explore the issue of community gun violence in the DC area. I'm your host, Amira Tripp Folsom. Here today with us is Dr. Joseph Richardson Jr. Dr. Richardson is the acting chair of the African American Studies Department at the University of Maryland and the Joel and Kim Feller Endowed Professor of African American Studies and Anthropology. Dr. Richardson's research focuses on four specific areas: gun violence, the intersection of structural violence, interpersonal violence, and trauma among Black boys and young Black men, the intersection of the criminal justice and healthcare systems in the lives of young Black men, and parenting strategies for low-income Black male youth. Trained as a criminologist and medical anthropologist, Dr. Richardson uses an interdisciplinary, intersectional, and longitudinal qualitative research approach. He is specifically interested in understanding the ways that the healthcare and criminal justice systems intersect and impact the lives of Black male survivors of violence. Dr. Richardson is the executive director of the Transformative Research and Applied Violence Intervention Lab, which uses a multidisciplinary approach to understand gun violence, its causes, and collateral consequences that will inform the development of innovative interventions to reduce gun violence and save lives. Dr. Richardson, thank you so much for joining us today.
Thank you for having me.
So, what led you to dedicate your life's work to community gun violence prevention?
I did it for both personal and professional reasons. Personally, I was born and raised in Philadelphia in a community that is lower middle class community, but I also have experienced the death of several of the young men who I grew up with in my community died via gun violence. And I've also experienced the firearm injury within my family. My aunt now is currently on life support. She was shot in the head as a result of a drug dispute. So I've experienced gun violence in my neighborhood, among young people that I know, I grew up with, and then within my family. And then professionally, as a doctoral student at Rutgers University, I started my life as an ethnographer studying violence, adolescent violence, Central Harlem, and then moved on after getting my degree to studying violence among serious violent youth offenders adjudicated in adult criminal court and detained in adult jails in DC. And then most recently, I've been using the busiest trauma centers in Maryland as my research labs because I'm really interested in the ways that the healthcare and criminal justice system intersect among violently injured young Black men.
You are not a stranger to gun violence. It's actually something that you have a lot of experience with. But when it comes to gun violence prevention activism, it seems like more often the focus is on more sensationalized displays of gun violence, like mass shootings, even though instances of community gun violence, like you mentioned, occur much more frequently in Black communities. Why do you think that is? And do you think that the two issues should be addressed differently or together?
I think they need to be dressed together, but what's problematic about the gun violence movement in terms of victims is the lack of value placed on Black lives in terms of gun violence. I mean, Black men are 6% of the entire population, but represent, almost 50% of all homicides via gun violence, but that has not been considered a public health crisis. But you can imagine if white males represented 6% of the population and they were 50% of all the victims of gun violence, we would have much more advocacy behind resources and interventions and the funding for interventions if the population were a different racial demographic. And I mean, that I don't think I'm preaching to the choir saying anything that's novel. I just think it's outright just the way that we have approached race in this country in terms of what lives are valuable and what lives are not deemed valuable. And most of the lives that have not been considered valuable since we arrived on these shores of this country have been Black Americans. And so the narrative just continues in terms of how victims of gun violence are treated and prevention and intervention efforts.
The devaluation of Black lives is a nationwide issue and spreads into every single way that we deal with issues that affect Black people in this country, including gun violence, which is a national problem. But to hone in more on the DC area for our listeners who are not from the DC area, could you describe the landscape in which community gun violence occurs?
Sure. So I would start by framing interpersonal violence first as a structural violence issue, meaning that there are specific populations in the District of Columbia, particularly populations that are Black and poor, that have been victims of structural violence in terms of the level or lack of resources that are being provided in those communities. And you can look at various different social determinants of health, whether it's education or employment or high rates of incarceration, which DC leads most US cities in an incarceration rate. DC has a COVID infection rate 6 times higher than whites. And then there you can also look at the racial wealth inequality gap, where you'll find that white households in DC have 81 times the level of wealth of Black households. And so for a white household, the level of net worth of wealth is $284,000. Again, $284,000 compared to $3,500 for the average Black household. And so you see all of these extremes in terms of health disparities and wealth inequality, which ultimately leads to and contributes to gun violence in these communities. And so the neighborhoods that are disproportionately overrepresented in terms of gun violence are also those neighborhoods that suffer from the increased health disparities and health inequities and the racial wealth gap. So you'll find the concentration of gun violence also in places where there are higher concentrations of poverty, which are east of the river, which are Ward 7 and 8, and also on the other side of the river, which is in Ward 5, which are predominantly wards that have suffered from increased poverty, food deserts, high unemployment rates, high rates of disease, and low educational completion rates, as well as high rates of stop and frisk by the police, right? So these communities are disproportionately over-policed and they're disinvested in. So when you culminate all of those things together, you will have high rates of gun violence. And then the last thing I'll add is DC also is the fastest rapidly gentrifying city in the United States, which has led to the displacement and the destabilization of many poor Black neighborhoods as well. And so people don't have a sense of place because their neighborhoods are just now being totally, in a sense, kind of colonized by big development, and they don't have a space for their own kind of identity and suffering from historical erasure. So these all are factors that contribute to interpersonal violence and gun violence within those communities.
One thing that you made really clear is that interpersonal violence is a symptom of a greater issue that is structural violence within the systems that exist in DC. And it seems like there are two completely different DCs. One that revolves around politics and privilege, while the other one experiences extreme poverty and constant violence. So could you explain a bit more about why these disparities exist, like which systems in place are creating these huge gaps between these two communities in DC?
Well, you have to look at the educational system, and for decades, DC ranked as one of the worst educational systems in the United States, despite being the nation's capital. The lack of representation in Congress, right? And DC for decades was unable to control its own narrative because it was primarily run by Congress, which led to significant racial segregation in Washington, DC. One of the things that I also neglected to mention in terms of your last question is how all of these things culminate to lower life expectancy rates. And so if you look at a neighborhood such as Woodley Park, which is in the upper northwest section of DC, which is upper middle class, the life expectancy is 89.4 years of age. Now you can travel 15 minutes to Ward 7, Ward 8, particularly in the neighborhood of St. Elizabeth, where you'll find a life expectancy is 68.4 years. So in a matter of a 15-minute drive from one section of the city to the next, just put this in context, you lose 21 years of your life expectancy. The politics of DC has had a significant impact on the way that DC is able to self-govern its policies and politics. And then you have to look across all of the systems, the healthcare system, educational system, which influence the number of people that ultimately land in jail. And so let's just, for example, third grade reading levels. If you're not achieving third grade reading levels for young Black children who are in the DC public school system, which again, I mentioned was one of the worst public school systems in the country for decades, then ultimately that will lead to high rates of high school dropout, which is correlated to higher rates of the number of people who are in the criminal justice system. And then once you get into the criminal justice system, it becomes a cascading and domino effect, because if you're saddled with a felony, then you're more likely going to struggle with the ability to get a job. If it's for a drug felony, you're unable to get a Pell Grant for a student loan, so you can't go to college. You're unable to live in public housing, and you're unable to receive public assistance in terms of even food stamps, right, in certain states. So if you take all of those things and the culmination of all of those issues, then ultimately you have what's called felony disenfranchisement and the collateral consequences associated with a felony, which further marginalize you as people as second-class citizens within this country. And that's pretty much what has happened in the policy and political landscape in terms of race in DC. And then ultimately we know that for Black males, the intersection of their race, their gender, and their age produces forms of marginality and the weaponization of all of these identities, where those identities combined are perceived as a weapon. So I recently read an article where they said, well, if your skin, your gender, and your age is perceived as a weapon, you're never really unarmed. So when you hear of the police shooting unarmed Black men, it's actually their weapon is, in fact, their identities. And the combination of all of these identities lead to the weaponization of their bodies, right? And so you don't really need a weapon when your skin serves, and your skin and your skin color, your gender, your age, and where you live serve as weapons.
You're so right. It really is just one thing after another. And in the nation's capital, you would think that these disparities should not exist when there is so much privilege that is like constantly being pushed in the media centered around DC, that the slightly different life that so many Black people in DC are experiencing is completely hidden. So I'm very happy that you're here speaking with us, because it's so clear that you're so knowledgeable on this. And on top of directing the African American Studies Department at UND, you've also completed postdoctoral research fellowships at the University of Chicago, Morehouse School of Medicine, and the University of North Carolina School of Medicine. So what has your research on community gun violence revealed to you about how gun violence should be addressed in these specific situations that you're researching and talking about today?
Gun violence should be considered as a public health and public safety issue, as we would consider the opioid crisis, right? And how do you manage to create a public health approach that can frame gun violence in that way, in the same way that we were able to reduce smoking across the United States, or we were able to address injuries that were incurred because people were not wearing their seatbelts. We need the same kind of public health and public safety movement in terms of how we address gun violence, and that requires the investment of resources in gun violence intervention and prevention initiatives. We mentioned in the outset of this conversation the social determinants of health. How do you begin to address the investment in education? How do you invest in employment opportunities, entrepreneurial opportunities in communities? How do you invest in housing? To close that wealth gap, though, I think really, to be quite honest with you, and you can look at the work of labor economist Sandy Darity, who has published a book, From Here to Equality, Reparations for Black Americans in the 21st Century. And I know it's a subject that many people, they hear the word reparations and they automatically get turned off by the connotations of it. But the only way to truly close the wealth gap in this country is through some form of economic repair. Because what Sandy Darity has found is that even if you look at wealth inequality, for example, a white male with no high school diploma actually has a greater net wealth than a Black male with a college degree. So there's no possible way, if you can educate yourself out of this wealth inequality gap. Like, clearly you can make some steps to improve your life as an individual. And I would never say that we shouldn't advance education. I just mentioned that it was one of the social determinants of health. But I also believe in terms of really addressing wealth inequality, there are going to need to be much more transformative approaches that have to be taken to address wealth inequality, which will ultimately lead to addressing this as a public health and public safety issue. In the same way that we've approached the opioid epidemic, which has disproportionately now affected white Americans, but we've decided to approach it using a public health approach instead of the criminalization of opioid addiction, we need to approach gun violence in the same way, in terms of how do these guns manage to get to communities where there are no gun stores in those communities. Guns are fairly expensive. There are people who have felonies who are unable to even access a gun legally. So we need to be questioning like the supply and the pipeline of how guns even make it to these communities, while also addressing, for example, how gun violence occurs in these communities. And I'll give you a perfect example in terms of COVID. So there are a lot of discussions now about why gun violence has spiked, particularly homicides, in cities across the country during COVID. So DC, and the last time I looked, had 180 homicides as of last week. For the entire year, last year, DC had 166 homicides, right? So we're already at 180 and it's still in November. But one of the things that I hear discussed are structural factors. Okay, it's high unemployment rate because of COVID, number of people who have lost their jobs, can't afford to stay in their homes, which I totally agree. All of those things are happening during COVID, which can potentially exacerbate rates of fatal and non-fatal firearm violence. But the other thing I would say is that there's also a drought of drugs that's happening in communities that rely on the drug economy to survive. Now, people will say, well, that's not a good thing. No, it's not. But I think what it points to, the way of looking at it from a different perspective, is people are engaged in the drug economy primarily due to the structural factors that led them to be engaged in the drug economy, which I've said that's all throughout this conversation. Lack of opportunity, education, lack of employment opportunities, the increase in the access to affordable housing, or the lack of access to affordable housing due to the increase in home values that are a result of gentrification. So the same reasons why people are engaging in the drug economy, which allow them to survive, may be one of the reasons why they're also engaging in gun violence right now, because the drug economy has collapsed in many cities across the country. You can look at any report from Drug Enforcement Agency and the UN to find that the level of drugs getting into this country has reduced significantly, right? Which creates a supply and demand effect. And some people may listen to this, say, well, he sounds crazy, but actually it's not that crazy at all, because that is what's occurring for people who are engaged in an economy that they're forced to engage in because they're suffering from these structural factors. So ultimately, if you don't address any of these structural factors in the very beginning, we're right back to where we are right now with this conversation of how do we get to this point of having these high rates of gun violence? And I think that there needs to be more attention paid to, not only are people just engaging in gun violence because they're in an argument that may go from 0 to 100 and two people have access to guns, but also how people rely on these underground economies because they're forced out and marginalized from legitimate opportunities, which force them to engage in an economy that is now on the brink of collapsing because drug markets are unstable due to supply and demand effects.
I'm so glad that you bring up reparations more specifically, because it doesn't place the blame on Black people. Because the situation that we are in is very intentional. U.S. government was very intentional in creating the current situation that most Black communities are in right now. And it's not like people are engaging in gun violence because they want to. It's because they are in situations that force them to be in that situation. And I know that your research also focuses on the intersections of the healthcare system and the criminal justice system. And you were the founder of the Capital Region Violence Intervention Program at the University of Maryland, Prince George's County, or PG County Hospital Center. Could you talk to our listeners a bit more about what hospital violence intervention is and what that program looks like and how that contributes to reducing gun violence in Black communities?
Sure. So the concept of hospital violence intervention programs was created in the mid to late 1990s, primarily by trauma surgeons who were concerned about the number of primarily young people that they were treating, and more specifically, young Black men who were coming into the trauma units multiple times for violent injury. And again, people would question, well, if someone was shot, let's just say in 2019, what would lead them to come back to the hospital again in 2020 and then possibly come back again in 2021? That would seem pretty odd to the majority of people that know nothing about why hospital violence interventions programs are needed. But what the trauma surgeons understood after operating on what we would call, let's just say, frequent flyers, and that's also defined as trauma recidivism, which means that you've been hospitalized 2 or more times for a violent injury, is that every time someone comes into the hospital for a gunshot wound or a stab wound, the likelihood of their mortality increases. And they are also a cost on the healthcare system because many people that come into the trauma unit for violent injury are often uninsured. So they become either a cost to the hospital or they become a cost to the public healthcare system because they are relying on public assistance for healthcare insurance. So up to 65% of all the people who come into a hospital for a violent injury, a gunshot wound or stab, they will come back to the hospital within 5 years. And 20% of that population will die within that 5-year period. So it's imperative from a public health approach and a public safety approach that we address and reduce levels of trauma recidivism among this population, but also the victim offender overlap. And so we also have found that people who come into the trauma unit for a gunshot wound or stab at some point in their trajectory have also injured someone as well. So they may have stabbed someone and they may have also engaged in gun violence from the side of being behind the gun or in front of it. So we have a twofold purpose. One is to reduce the level of trauma recidivism for bringing people back to the hospital multiple times for an injury, but also reducing the level of their engagement in violent offending. Because if many that come into the hospitals that are violently injured often are thinking about retaliation once they're discharged from the hospital and retaliating for the person that injured them, which leads to this cycle of violence. So hospital violence intervention programs are designed where you meet the person, your patient at bedside. We used a violence intervention specialist, Che Bullock, who was also a young man that was violently injured. And in fact, he was in my previous study that I conducted at the University of Maryland, Prince George's Hospital Center before I created the program. And so I had followed the lives of 25 young Black men who had been victims of a gunshot wound or stab to understand their lives over a 2 to 3 year period and to understand the social context of violence in their neighborhoods in DC and how I could use that data to inform the development and implementation of this program. And so that study led to the development of the program. And I decided that I would utilize Che as the violence intervention specialist because he has shared lived experiences with the young men that are coming to our hospital for a violent injury. And so he approaches them at bedside, and they often connect with him because he has a shared experience. And then he serves as the bridge to the psychosocial services that the hospital provides. And so we provide mental health counseling in the form of cognitive behavioral therapy to reduce symptoms of traumatic stress. So we have a clinical counselor assigned to our program that provides that therapy. We also provide educational opportunities to get young men into college or to get them into a vocational program, and employment opportunities as well. So the combination of all of these things, in addition to the mentoring that's done by the violence intervention specialists, both within the hospital setting and upon discharge, can reduce the levels of trauma recidivism. And so our program, when we started, we had a trauma recidivism rate of 32% before we started in 2017. By 2019, we had 116 participants, and we had one person come back to the hospital out of the 116 young men we had in our program. So that's a trauma recidivism rate of less than 1% if you do the math. So we were able to reduce it from 1 out of every 3 persons that came into our hospital that were in our program did not come back, to less than 1% of that population. So, and there have been other studies that have shown that hospital violence intervention programs work. There are over 40 now hospital violence intervention programs across the world. So they're spreading, and there are more organizations and hospitals that are willing to support the programs, but there also are issues around sustainability in terms of state legislatures writing in their line item budgets to support these programs over the long term.
That's amazing. And what I appreciate about hospital intervention programs in particular is that they bring value back to these men's lives, because especially in the criminal justice system, we are taught that after something happens to us or we do something to somebody else, that our lives are not worth anything anymore. And so I really appreciate that work is happening and that it's working. Hospital violence intervention programs are not the only forms of activism that are happening in the DC area. For those who are listening right now who are not from the DMV, it's really important to recognize that there's already so much work happening in DC already by activists who are from the area, who have dedicated their lives to this work, and people like Dr. Richardson as well. And for people who are listening right now, whether they are in the DMV or planning to move here, what can they do to help or support the community gun violence prevention work and activism happening here already?
Well, I would say one of the things, at least in terms of sustainability, for example, in Maryland and Prince George's Hospital, for those who aren't in the DMV, Prince George's Hospital sits right on the DC border. So while it's in the state of Maryland technically, because it's the closest trauma center to many of the neighborhoods in DC where there are high rates of gun violence, what the DC government has provided grant funding to support that program. But on the Maryland side, there's a Maryland Violence Intervention and Prevention Fund, which had supported Prince George's Hospital, as well as University of Maryland, R. Adams Cowley Shock Trauma Center, which I work with now in Baltimore, supporting those hospital violence intervention programs through that Maryland Violence Intervention Prevention Fund. Now, recently, Governor Larry Hogan vetoed the Maryland Violence Intervention Prevention Fund. It was roughly $3.6 million to support these programs, as well as other prevention and intervention programs across the state, such as Safe Streets in Baltimore, which some people may know as Cure Violence. And that initiative was supporting those programs as well. And so during the time right now where we're experiencing a gun violence epidemic in Prince George's County, as well as in Baltimore and DC as well, but I'm specifically speaking about Maryland, the governor has vetoed that bill. And so there's no funding out there to support these programs. Now, what an activist can do is push for legislators and the governor to include this kind of funding as mandatory in a line item budget for the state. We should not have to request every 3 years or 2 years that the governor reconsider funding violence intervention and prevention programs. You'll find in other progressive states where they reduce gun violence, like California, which has CalVIP, they have that built in as a line item into their state budget and as a public safety issue. That should be the same in Maryland, right? So what we need more activists to do is to engage with legislators in terms of making sure that these programs are funded and they're sustainable over the long haul. And the other thing that activists need to do is also push for increasing the federal dollars for gun violence research. Due to the Dickey Amendment of 1996, the CDC and the NIH were unable to fund gun violence research for at least 24 years. This is the first year in 2020 that the CDC and the NIH provided funding for gun violence research, which was only $25 million in total. And if you think about that amount to cost of gun violence research, which is $229 billion, so you compare $229 billion to $25 million for research, it's just totally out of scale. And so what we also need activists to do is press the federal government, and particularly their legislators who work on the federal level, to advocate for increasing gun violence research so we have the dollars to understand what's really happening in terms of gun violence across this country.
So it's on the local, state, and federal level. There's something that everybody can do who is listening right now to get involved in help solving this problem. And so, Dr. Richardson, do you have any last things that you want to add before we conclude the podcast?
No, I just want to thank you for inviting me and for your advocacy for gun violence intervention and prevention. And we need more podcasters like yourself and activists to engage in this work to get the word out. And so I'm honored and humbled that you invited me to be on your show. And I hope that you continue to inspire people to engage in this kind of work.
Thank you so much. And thank you for joining me. This concludes this episode of the Other Side of DC podcast. Thank you for listening.